One of the most difficult things to handle, and this is something 90% of the women will agree with me on, is the weight gain and the difficulty in losing weight in your 40s. Now, looking at myself as a case study, I delivered my second child in my mid 30s and I had put on close to 25 kilos during my pregnancy. But I put my heart and soul into it, did mindless cardio, ate almost nothing, and did the craziest things imaginable for a year after my delivery and managed to lose some amount of weight. After this phase, I discovered strength training and changed my diet to fit my goals and managed to bring my body to a point that I was happy and comfortable with. And then, when I hit my early 40s, I started seeing a few changes in the body, which were still ignorable. But once I hit my late 40s, the changes became much more unmanageable. My body was gaining fat easily, and earlier, if I put on a couple of kilos, I could lose it easily with a little bit of disciplined eating. But now it became a lot more difficult, even though I was doing the same things that I was in my early 40s and late 30s. So, why exactly is all this happening? This is where you need to understand perimenopausal changes that are occurring in your body. Your hormones are changing, and you need to change certain things in your lifestyle to cope with these hormonal changes. If you find our content useful, subscribe to our channel and stay connected with us for more information on health and wellness. Firstly, your estrogen levels start dropping. When estrogen drops, we become more insulin resistant, and when we become insulin resistant, the body is unable to utilize glucose like it could earlier. And so, this excess glucose, what happens to it now? It gets stored in the body as fat. Also, I noticed as I was getting into my 40s, I was losing my cool a lot. I would easily snap at people. I was getting more and more intolerant to noise, and my sleep quality was deteriorating. So, what was happening here? All this is because another important hormone called progesterone also drops during perimenopause. This drop in progesterone makes you more prone to stress, and this results in more cortisol, which will again reduce the activity of insulin, which again leads to fat accumulation. This drop in progesterone also reduces melatonin production, which is a sleep hormone, leading to poor sleep quality, which again will make your weight loss difficult. Another issue it changes is with your muscle mass. So very important, I cannot stress enough on this one factor that you have a lot of control over. With age, you're losing muscle mass. But here's what you're doing wrong to ramp up the rate at which you are losing it. You are gaining fat around perimenopause. So what are you doing? You are increasing your cardiovascular activity and you're trying to cut out more and more calories since you're finding it difficult to lose weight. And this is just not going to work because doing this is going to make you lose more precious muscle mass. Now, here's what you should be doing during your perimenopausal phase. First, you should involve yourself in activities that stimulate your parasympathetic nervous system, or in other words, activities that calm you down, like deep breathing, guided pranayama under a trained instructor, meditation if that's feasible for you, reduce noise and light stimulation after dark. This will help you calm down and also sleep better. Staying calm will lower cortisol, which will help your body be more insulin sensitive, which means less fat accumulation in the body. Next is to focus your training towards muscle preservation at the very least if muscle building is not an option for you. Muscle is your best friend during this phase. So strength training is essential at this phase of your life. Next, as far as your diet is concerned, reducing food quantity mindlessly out of desperation will only make you yo-yo back and forth. You can't be eating less. You need to eat as much as your body needs with sufficient protein and whole foods. Finishing dinner a couple of hours before bedtime is important not only for overall health but also to up your sleep quality, which really needs help during this phase of your life. Finally, but not the least, Find a good gynecologist who will sit with you, discuss your problems with empathy, and give you what you need. I know there is a lot of conflicting data around hormone replacement therapy, but many women do well with very small dosages of HRT as well. So speak to a healthcare provider who doesn't treat menopause as something that everybody goes through and brushes your symptoms off. I'm not debating the fact that our mothers and grandmothers went through this as well, but the number of stressors we have right now are tremendously higher than what was there a few decades ago. So find the right professional who can give you time and tailor-made solutions to help you if needed. So to summarize, don't cut food and calories mindlessly. Give your muscle a chance at preservation, so stay active with resistance training. Focus on utilizing the glucose post meals by taking short walks after meal times. Allot some time for calming practices. Reduce exposure to blue light in the evenings, be it cell phones or laptops. And finally, have a good and empathetic physician on board.